Today, we're talking about something I've seen hundreds of times across 30 years of nursing. A man comes in and he's tired. Not end of a long day tired, tired in a way that seems to be following him. He's sleeping, but he wakes up already behind. He's putting on weight without changing lifestyle that much. He's snapping more than he used to, and somewhere in the back of his mind, he's starting to wonder, is this just what it feels like to get older? Well, it isn't. And today we're going to talk about why. But before we get into today's topic, a question came in this week from a man who said his name was Joe. He's 51 years old and he works outdoors. He's a land surveyor. He wrote, 2 years ago, I was diagnosed with Lyme disease. I was treated with antibiotics, and they told me I was clear, but I still don't feel right. I still have joint pain, brain fog, and exhaustion. My doctor says my tests are normal now. So why do I still feel like this? Hmm. Well, Joe, first I want to thank you for your question and to let you know you're not alone with this, and also to let you know that what you're describing is real. It's not in your head. What you're experiencing has a name. It's called post treatment Lyme disease syndrome, sometimes called chronic Lyme in broader conversations, of course. Here's what's known about it. Lyme disease is caused by a bacterial infection transmitted through a tick bite. When it's caught early and treated, most people fully recover. But there's a portion of people, somewhere between 10 and 20% by some estimates, that their symptoms persist long after the antibiotics are done. The frustrating reality is that standard testing doesn't always reflect what the body is still experiencing. And basically saying a normal test result doesn't necessarily mean that your system is fully recovered yet. It means the markers that are being tested for came back and they were within that range, right? Those aren't always the same thing. What I'd encourage you to do is find a physician that is specifically experienced in post Lyme management. Not every doctor has that. You'll need to ask questions. What you're describing is a recognized pattern that deserves continued attention, not a closed file. And thank you, Joe. You deserve a doctor who takes the time to understand what's going on with you. Wishing you the best in finding that. And thank you to everyone who is sending in questions. Please keep them coming. Now, let's talk about fatigue, sleep, hormones, and the loop. Most men treat these as three separate problems, but they're not. They are one system. And when one part starts to struggle, the others follow. So after 40, sleep changes. Not just the hours, the quality of the sleep. You spend less time in deep, restorative sleep and wake more easily, let's say. You might fall asleep without any trouble at all, but the sleep itself isn't doing what it used to. And here's what matters: deep sleep is not just rest, it's when your body rebuilds. Growth hormones release, muscles repair, and cortisol, your primary stress hormone, resets for the next day. That reset doesn't happen. And you start the day already carrying yesterday, if that makes sense. Cortisol is not the enemy. You need it. It gets you moving in the morning. It manages inflammation. It helps you respond to stress. But it runs on a rhythm: high in the morning, declining through the day, and then low at night. So sleep can do its work. When the rhythm breaks through poor sleep, chronic stress, or sustained physical demand, cortisol stays elevated when it shouldn't be. So later in the day, right? And when cortisol is chronically high, you see the same three things consistently. It becomes harder to hold muscle, belly fat accumulates more easily, and testosterone quietly drops. Do you see the loop starting to form here? So, poor sleep raises cortisol. High cortisol lowers testosterone. Low testosterone worsens sleep. And now you're exhausted and you can't figure out why. We touched on testosterone specifically in episodes 4 and 13, but here it becomes clearer why it matters beyond the gym. When testosterone drops and elevated cortisol accelerates that, fatigue stops being occasional. It becomes the baseline. Low motivation, slow recovery, uh, flat affect or flat mood, weight that won't shift, not because something is catastrophically wrong, because a system is struggling quietly, gradually, and without it announcing itself. It never tells you it's there, right? So I need to speak directly to the men who work rotating shifts, nights, earlies, variable schedules. I've seen men work 15 years of shift work and tell me, huh, I thought I was just getting older. Well, they had been getting older, but they blamed it on their age, where in fact, their cortisol rhythm had been completely disrupted for a decade. Their sleep architecture had never fully recovered between rotations, and their body had been running on reserves for longer than they realized. If that sounds familiar, you're not imagining it at all. Your physiology supports exactly what you're experiencing. Fatigue that doesn't resolve with rest is a signal, not a character flaw, not an inevitable consequence of age. It's a signal. The man who is exhausted despite sleeping 8 hours is not lazy, he's not weak, he may be caught inside a loop that's been feeding itself for months and or years. Understanding that changes everything about how you respond to it. So, what you need to take to your doctor. If this sounds anything like you, bring the full picture to the doc, not just fatigue on its own. Ask for testosterone, total free, and SHBG, which is sex hormone binding globulin. Ask for morning cortisol, thyroid function, TSH at minimum. Thyroid stimulating hormone is what that is. Potentially a sleep assessment if disruption seems to be as significant in your life. These together, all of these parts together, will tell you the real story. If you just looked at one of those numbers, like one of those tests alone, it's not going to give you the complete picture. So make sure you get the whole story. Look at the information contained within this video does not provide personal medical advice, diagnosis, or treatment, and should not replace consultation with a qualified healthcare provider. Needing to say that, right? Well, it's that time, folks. It's all the time we have for today. Look, fatigue is not your identity. It's information. And now that you have a framework for what your information means, not three separate problems, but one system that can be understood and addressed, that's where it starts. I'd like to thank you for being here and thank you for trusting me with your time.